Good afternoon, everyone. I'm Erica Davis, and I'm the nurse practitioner here at Bon Secours Richmond Community. I work with the neurology group, and today I'm here to this is Stroke Awareness Month, so I'm here to discuss stroke and hypertension with you. Bon Secours would like you all to recognize what these signs and symptoms of stroke. Be fast. B is for balance. So if you noticed anyone or yourself having difficulties with balance, we want you to get to the nearest certified stroke center nearby. Next one is E. E stands for eyes. If you have blurred vision of any sort, we also want you to call 911. Facial droop is next. So for facial droop, this is very common. Everybody's aware of this when it comes to stroke. So if either the left or the right side of your face starts to droop, or you notice that it's more weaker, we would like you to call 911. So then the next letter is A. A is for arms. So in a stroke patient, the left side or the right side may be weaker. So if you notice that you start to have some drift, call 911 and get to the nearest certified stroke center. And then there's S for speech, whether it's speech having difficulty speaking or slurred speech, get to the nearest hospital. Then the last one is time. Time is everything. Every second you're losing neurons if you do not get the proper treatment needed for a stroke. Well, with stroke being the causing disability in the United States, as well as the fifth leading cause of death, it is highly preventable and treatable because there's several modifiable and non-modifiable risk factors. The one that I'm going to discuss is hypertension. Hypertension is the leading modifiable risk factor for preventing and treating stroke. Well, let's talk numbers. Yes, guidelines have changed, and now we have new measurements of what hypertension is. Another people may call it high blood pressure. Guidelines now note that any measurement above 130 systolic and 80 diastolic, systolic being the top number and diastolic being the bottom number, are now the new measurements for hypertension, high blood pressure. It used to be 140 over 90. So I do have a chart, and you can find this on heart.org, where it shows you now the normal is 120 over 80, and then it goes into elevated. We did change the term for pre-hypertension to elevated hypertension to make people more aware of the lifestyle changes that need to be implemented at this point. So that's still 129 over, and then less than 80. And then we have stage 1 hypertension, and this is where we get into the 130 through 190 millimeters per mercury, or 80 to 89. Then we go into hypertension stage 2, which is 140 or higher, or 90 or higher diastolic. And then the crisis, this is emergent. If you were ever to have a blood pressure higher than 180 and or higher than 120, then you're in a hypertension crisis, and this needs definitely to be evaluated by the hospital or your primary care provider. I also wanted to allow you all to know that the reason for the change in the guidelines is because data has shown that you are at greater risk of heart attacks, strokes, or any other consequences of hypertension when in the beginning of 120, when you start to increase at that point. In fact, the risk doubles when you get to 130 compared to at 120. So any questions that you may have?
If someone is now diagnosed because the guidelines have changed, do they need to start on medication immediately?
No, we do. First and all, most of the change is so that we can implement lifestyle changes first. So we want you to make the appropriate lifestyle changes, whether it's diet or decreasing the amount of sodium. So is very important. Starting maybe a DASH diet, implementing that may be important. Exercising. We always recommend that you do at least 30 minutes of exercise in addition to what you're already doing for a weight loss component. So just 30 minutes of exercises a day can decrease your blood pressure in itself. So lifestyle changes are what we want to implement first before even discussing any type of medications.
Are there any special recommendations for different races or ethnic groups?
Yes. So to an extent. So the recommendation for selecting blood pressure or lowering medications are generally the same for all Americans. However, there is a couple of considerations for the African American due to genetics or common responses to certain medications and their problems. An African American with hypertension without heart failure or any type of chronic kidney disease, including those with type 2 diabetes, initial blood pressure lower treatment should be included, like thiazide. So I know several of you have heard of hydrochlorothiazides. These are kind of diuretics. So many people will say this my water pill. That's the hydrochlorothiazide. So that's usually the first approach that they take. And then calcium channel blockers are more appropriate for African American population. There has been huge debates on whether they should be put on the ACE inhibitors because of the high risk of angioedema. And that's just, it's very personable. So that's a customized approach. So it just depends on your provider on what they feel like is appropriate for you at the time.
Are the guidelines for blood pressure the same for all ages?
Yes, they are. There's no change per age.
So why did the guidelines need updating?
Okay, so the guidelines need updating because there was growing body of evidence that lowering blood pressure is better for your health. The 2017 guidelines reflect the new information to help people prevent and treat high blood pressure sooner.
Are there any events coming up?
Yes. So one I want to emphasize is that Bon Secours on Fridays, we do have a hypertension clinic that is for educating the community, mostly Richmond community population, about blood pressure. We are open from 8 to 4:30 on Fridays. If anyone would ever need to make an appointment, they can just come up in Richmond community, or the emergency room will typically direct you to the clinic. But we also have an event called Jazz Up Your Health. And this is an event that is collaboration with the American Heart Association. And the American Heart Association and I do an event called Jazz Up Your Health. Jazz Up Your Health it's going on, this is its 5th year, and it's to provide education for the community about stroke awareness and hypertension. And we have guest speakers. We do have survivors of stroke who are present. We do have Zumba classes. So we implement all the 5 lifestyle changes there. So there's somebody teaching you how to cook. There's Zumba classes, like I stated earlier. There's providers there that you can discuss any questions that you may have that you may not have gotten when you went to the doctor to get your annual physical. And it is free. And then we top it off with some jazz and good music, and it will be held on May 31st.
Where will it be?
Right now, it's going to be located at the Convention Center.
Thank you, Ms. Davis. Do you have anything else to add?
The only thing I would like to add is be fast. Remember, if you notice any signs and symptoms of stroke, please go to the nearest certified stroke center by calling 911. Do not drive.